Well, hello, and thank you for all coming out to hear a little talk about Ebola. So I'm Todd Frankel. I'm with the Washington Post, and for you who's keeping track, I got back from Sierra Leone on September 1st, which is, God, almost 2 months ago. And so I am clear of the 21-day incubation period, which is very important to people and important to me. And I'm clear of the 31-day when they started floating out there, and even the 41 days. So I'm good, and I'm thankful for that, right? Because like right now, breaking news out of New York apparently is there's a doctor who apparently just came back from Guinea, and he was working with the MSF, Doctors Without Borders facility there, and he came down with 103-degree fever and stomach pains, and he's at Bellevue right now, and he's being evaluated. Now in the media we've been tracking all these like suspect cases, and 99% of them are, the flu, right, or malaria. But this one sounds pretty scary, right? Because he came back from a treatment center. And those are the ones who are really risking their lives, are these doctors and nurses who are coming from the US and going over there, right? And so if you're living in Guinea, in Sierra Leone, in Liberia, and you're in the midst of it, that's bravery, step one. But then coming from here and going and working in those treatment centers is unbelievable. And so I had the pleasure, and I'm going to talk about meeting some of these infectious disease doctors and these different doctors and the nurses, these people who pretty selflessly went and decided to go to battle against this disease. So this picture is, I'm going to say a quick word about my pictures, right? So I'm not a photographer. And you'll notice some of my photos in here are not the good ones. So those are mine. But some of the other ones, we'll make sure I get full credit. This one is like a Doctors Without Borders photo, MSF. I'll just call them MSF. And the other ones are by Pete Mueller, who was a freelance photographer that the Post hired, and I overlapped with at different points in Sierra Leone. Today I'm going to try and talk about what was like reporting in Sierra Leone, why I went, and also what the situation is there on the ground, because I've continued to cover it since coming back. And then hopefully we'll have time for questions, because I sometimes love hearing the different perspectives on what's going on. A big part of this Ebola thing is fear. Right? I mean, I know I was scared before going over. I was scared while I was there. I was scared when I came back in that 21 days. And I think a big part of that is, and I think why it's captured the imagination of people and made them scared is, doctors who have to dress like this, the full PPE, and it's just amazing to see when you see people dressed like that. I mean, it's just, it's for their own protection, right? But it's quite heart-wrenching to see folks like that, and it just tells you what sort of battle we're up against over there. So this is one of Pete's photos to show you Sierra Leone. A beautiful country, absolutely beautiful. So I had never been to, not West Africa, I had never been to Africa before I went. And I was blown away by how beautiful Sierra Leone is. It's got beautiful beaches right there on the ocean. Really great people. It's a very poor country, one of the poorest countries in the world, one of the lowest UN development indexes in the world. I think the life expectancy prior to Ebola was about 48. There's diseases there. They have problems with malaria, typhoid, diseases we just don't really worry about here. The under 5 mortality rate is really high. So they had a lot of problems going into this. And they have another hemorrhagic fever that's endemic to the region called Lassa fever. And it's in the Mano Valley region, which is where Guinea and Liberia and Sierra Leone all sort of meet. And actually, I haven't heard that they've named this Ebola strain yet, right? So usually each outbreak gets a different name, like the Tikrit strain, and then there's the Zaire strain. And this one, maybe one day will be called the Mano Valley strain. I don't know. So this is a picture in Sierra Leone, absolutely stunning picture. So again, I just want to put it on the map, because before I went, I probably wasn't too sure where Sierra Leone was. And it's in West Africa, right? And it's, I'll zoom in there a little bit closer in a second, and just sort of showing you, it's there on the left side of that graphic there. And talking to people there, they sort of divided Africa into 2 categories, Africa heavy and Africa light. And Africa light being like the easy countries, the more westernized countries like South Africa, Ethiopia, Kenya, places where you could go and sort of, just sort of hang out, do well. You wouldn't have to do too much preparation for traveling. And then there's Africa heavy, which pretty much was West Africa. So again, even without Ebola, I had to worry, and the people who respond there have to worry about, don't drink the water. I had to worry about what I was eating. In order to get into the country, I had to worry about, I had to get a yellow fever vaccination and a whole bunch of other, typhoid vaccinations. And then malaria is a big concern in this country as well. And so I was taking antimalarials, which isn't that unusual for a traveler, but I was surprised to find out that even MSF's doctors who have worked in Africa for most of their careers, for the first time in their careers, they were taking antimalarials in this outbreak. And you can't take antimalarials for too long of a time, so they transition people in and out. And the reason they were taking those is because they didn't want to get sick for any reason, right? Because if you pretty much, the same symptoms you have with malaria, the same symptoms you have with Ebola. And if you come down with a fever after working in a treatment center, you have to assume you have Ebola. And they just didn't want that. So for the first time in their careers, they're taking antimalarials. So for me, that was like, whoa, this is, it's a big deal. So this map here shows you the different plane routes. We've had a lot of talk about travel bans and, let's just draw a ring around the 3 countries and shut the door and just, let's just go forward from that. And it sort of shows you exactly how people get out. The route to the right towards China and India has been shut down. Actually, they do have a travel ban. You can't go that direction anymore out of West Africa. You can no longer go directly from West Africa to the US, right? And so now everything goes through Europe. And one of the factors of, I was actually fairly easy for me to get into Sierra Leone. I went through Paris on the way in. I took Air France, and then when I was in country, Air France decided to stop flying, and then Air Brussels stopped flying, and one other airline stopped flying, in addition to all the small regional carriers who within this part of Africa stopped flying. And so I was down to Air Maroc and Brussels Air were the only 2 airlines out, and it became a real problem with so much for me getting out, but also different first responders, of medical staff, and getting supplies in and out. And you need these routes. So now the only way to get out of there is to go through, pretty much through Brussels. Most of the flights end up going through Brussels. Also, you can go to Casablanca and get out as well. So different ways to stop the relative importation risk for doctors in other countries. So zooming in a little bit more, you can see where Sierra Leone is there on the map. Oh, and I have a pointer. I put in my pocket. I did. How about that? Right, so Sierra Leone, right there. And here's Freetown, the capital city. So it's a country of about 6 million people, and 1 million right there in Freetown. And the outbreak happened right in this region, right in there, right in Guinea. Started in Guinea, spread over in Sierra Leone, at the same time spread over into Liberia, and spread out this way, just down and this way. It hit Monrovia first, major city, and then when I was there, it was just beginning to really hit Freetown. Which again, so in 1976, Ebola was discovered. We've known about this disease at least for that long, but this time out was different, right? Because it came into populated centers, places where Ebola had never hit before. And for a disease that is spread through close contact with bodily fluids, right? Blood, sweat, saliva, urine, that's a disaster. It's a real disaster. And right now, we're in a situation where we're trying to figure out how to undo all this, right? How to get out of this situation. So that's where we are there. So that's where Sierra Leone is. A lot of people get a bunch confused, but Conakry has actually not had that many cases. They have done a better job. And actually, Guinea is a wealthier nation and has more doctors and has a better surveillance system than Sierra Leone or Liberia. Just a quick little bit of history about Sierra Leone, and also this mirrors what happens with Liberia. About a decade ago, Sierra Leone and Liberia get out of civil wars that had destroyed their basic infrastructure, and not just roads, but like their health systems, their governments, just everything laid ruin. And they're just sort of beginning to get back on their feet, turning a slight corner, getting things going, and then this happens. And so all these institutions that have been built up since the Civil War have collapsed once again. Now, the governments are still there, but they're hanging on by a thread. And that's why it's really important that the international community sort of floods the zone and sort of props up these moments and sort of gives them a shot to get out of this. Right, so to show you when I went is in this zone here. So this is cases of Ebola, right? And this is the overall log line, right, of number of cases. And you can see it is just, here we are in March, and here we are right about now, right? And it is just exploding, right? That's not the trend line anyone wants to see. When I went there, it was like that. This is where it was, and you see it's gotten fairly bit worse here, fair bit worse. Of course, no one believes that these numbers are real, right? That it's 2 times at least worse than what we're seeing here. But even here, it was, it sort of looks a heck of a lot better than it does here, but it's still really a really big problem even then. Right, so reporting on Ebola. The Washington Post has a lot of experience reporting in war zones, right? There's people I can talk to and ask, hey, so if I go to Afghanistan, what should I watch out for? What should I carry, you know? We have experience covering all sorts of different things. We don't have any experience with covering Ebola. Hardly anyone does. These outbreaks are rare, right? They usually flare up and disappear fairly quickly, relatively quickly, and usually in really remote spots. So I was the first Washington Post reporter to cover Ebola, which was interesting because I had to sort of make it up, what the lines of Call of Duty, what I would do, what was safe, what I needed to pack. And so this is a picture here of what I did pack, 1 suitcase of what I brought. And so what I did was I sort of started to investigate, sort of treat it like any story. And I spent many hours on the phone with the CDC, who were very kind in walking through what they were telling their own people, what their advice was to them. I talked to the handful of other reporters who were in country before me. One reporter, Jennifer Yang from the Toronto Star, was a great resource. Talked to a New York Times reporter who had been there previously. NPR actually had one reporter there before. So relying on them, I sort of tried to make up on my own a mishmash of guidelines of what I could do to keep myself safe. Because it really is, even now I think we're seeing, those rules sort of change and get fine-tuned and doing things differently. So it's amazing what you can buy on Amazon, because I was able to buy my own PPE, right? The own moon suits, right? Which is the little white Tyvek suit there. And I bought germicidal bleach wipes and some nitrile gloves and a mask, and also very importantly, rubber boots. And also in here, you can't barely see this, is a spray bottle and protective eye goggles. And I brought a bunch of other stuff too. But so the thing I use the most, I actually never put on the PPE. I never put on the gloves. I never put on the mask, although I was tempted at different times to put it on. But I never put any of that stuff on. What I pretty much subsisted on was using these germicidal wipes and this spray bottle. And what I was using, I had the spray bottle, I was wearing a backpack, and I had the spray bottle right in that little spot where you keep your water bottle, That's where it was. And I made up my own homemade batch of hand cleansing solution, following MSF guidelines, right? And so you have to learn all sorts of weird things to go overseas for this sort of reporting. It's 0.5% bleach solution, I think, for cleaning off your boots, right? And then it's 0.05% for hands. And I can guarantee you mine was a little bit stronger than that, actually a fair bit stronger, just to give myself a margin of safety. And so I use that a lot. And actually, it was actually weird. I was talking to the CDC, and they're like, hand washing, that's all we recommend, soap and water. I was like, no. Because apparently if you just wash your hands, the bowl will come right off. But, I wanted something stronger. So that's what I use. But also hand sanitizer actually works as well. As long as it has, I think, 65% alcohol, that works as well. So it's not an especially hardy virus, right? It's not like something that's really tough to kill once you get at it. The problem is that it's kind of easy to catch. Not really easy to catch. It's not like the flu, right? So it's not spread by airborne transmission. Like pretty much none of you, even if I was deathly ill right this moment, would have any worry. Now, if I had the flu, you could catch the flu from me right now. I had my flu shot. But even if I had Ebola right now, none of you would be in danger, right? Now, there is some confusion, right, about well, what about droplet spray, right? And there is some confusion about that, right? And the thinking that is that if, when people talk, sometimes there's that spittle that comes out, when someone's a close talker. And if you stand too close to that, if that somehow ended up like hitting you in the eye or in the mucous membrane, and they had Ebola, and all those things went right, perhaps you get infected. I don't think anyone's actually proven that this has ever happened, but it's a theoretical mode of transmission. Whereas me just talking and breathing and passing out and spreading out around here, that's not going to happen. So with that in mind, though, right, margins of safety. So what we practiced over in Sierra Leone, which everyone does, not just reporters, but the doctors as well, is something called social distancing. So I pretty much didn't get close to anybody, right? So I kept maybe 6 feet. The idea being the droplet spray was 3 feet, that it would be weighted down and fall to the ground, 3 feet. 6 feet, I didn't get any closer to anyone than 6 feet. And I tried to keep it even a little bit more than that. And that's tough for a reporter, right? Because I want to get close to people. I want to hear their stories. I want to see what they're seeing. But I had to keep that distance, right? And you pretty much have to assume that everyone has Ebola, right? Because it's just safer that way. There's no one that you let inside that safety line. And even when I was talking to different members of the CDC or infectious disease docs from different schools, who I'm going to introduce to you to some of them, we kept our distance from each other. Even we'd sit down at a table and have drinks, but across the table, right? And it was difficult. It was really difficult, and especially if you're living in Sierra Leone, a country of 1 million people, or in the city of Freetown with 1 million people, and it's cheek to jowl. It's a really crowded city. These taxis they use called poda-podas, and they pack like 12 people into these little minivans, and the government actually passed a law limiting the number of people allowed on the poda-podas, right? Because what they're trying to do is not get people touching, just give you some distance. They shut down all the nightclubs, not allowed to have any large public gatherings. It's the sort of thinking of that, let's give some distance, we need to keep apart, which is very difficult for people. So that's what I packed. That's what I carried with me. Right, so this is my photo. And so this is really interesting, is in Sierra Leone, every single shop, every single restaurant, every place had these little buckets outside. And you can see there's a little spigot on the front. And these are hand washing buckets. And they were distributed by the government, all these different hand washing buckets. And then you're supposed, each person's responsible for filling it with some sort of bleach solution. And it was fascinating because everyone was very diligent about washing their hands using this. And if someone skipped it, actually they were very good about self-enforcing it, right? Saying, hey, go wash your hands, not letting anyone pass without doing it. How effective that is in breaking the train of transmission, perhaps not so great, but it was great about reinforcing the message, right? Ebola is here, we need to do something, we need to be on point. It's amazing too that you go to different places and you wash your hands and they'd all smell different because everyone's making up their own solution, I'm not exactly sure what I wash my hands in, but it's all right because I had my own solution ready to go right behind it. Again, here's another one. This is at the WHO, their hand washing bucket, right? This is at the WHO has a permanent compound in Sierra Leone, and like I said, they're normally addressing topics of child malnourishment and maternal health and different things like that, and now they're dealing with Ebola. And so these are the ways they're trying to communicate to a populace that is largely illiterate. There's not a well-educated population, and they're trying to use illustrations. Prevent Ebola, it says, signs and symptoms of Ebola: fever, vomiting, diarrhea, bleeding, muscle or joint pain, skin rash. And then down here it says, how to prevent Ebola: wash hands with soap. Avoid eating bushmeat. Avoid eating fruit that bats might have come into contact in the wild. And this one I can hardly make out. I don't remember that one. And it's explained here the treatment for Ebola, right? So what they're trying to do with these signs, there was these signs everywhere, not just this one, but different forms of them. A is make people aware of what the symptoms were. There was a very big concern early on about reinforcing this message of don't eat bushmeat, because thinking that was a way of transmitting the disease. I think they've come down off of that, right? Believing that eating bushmeat, which here we call venison basically, right? I mean, just something that you shoot that's wild, but there's like maybe a chimpanzee. They were worried about that being a way to spread Ebola, and maybe it started it, but they've realized that we're not seeing new transmissions, right? New entrants, zoonotic diseases making the leap. This is one strain, most likely, that seems to have made the leap. Most likely maybe from a bat. It doesn't really matter at this point. We got to deal with it. So they've actually toned down this message because it was met by a lot of resistance by people who want to eat their bushmeat. And how dare you tell me not to eat my bushmeat? And so they've come down off that and started to focus on these other things. And again, it was also trying to get people to understand that if you went to a treatment center, it was not a death sentence. That this was your best measure, to fight this disease. Right, so the rubber boots, this is a field of MSF's rubber boots that they lay out to dry. So most of the gear they wore was disposable for good reason, but the boots were, again, washed off with that 0.5% bleach solution and hung out to dry, and things like that. Here's an MSF worker taking care of a child. So I did not go into any of these treatment centers. These are high-risk areas. MSF welcomed me to come inside one of the treatment centers, but they said I had to stay for 21 days, right? They don't want anyone in the treatment centers. Those are high-risk areas. And here it is a MSF worker taking care of a young child, and the disease is devastating. It really is to see this sort of stuff going on. And again, they're doing this incredible work in making it work together. And the treatment facilities are so primitive compared to what we have here in the US. They're all pretty much outdoors. If they are indoors, they might have a window unit, maybe. The electrical grid there is incredibly unreliable. Generators are essential. No ventilators for the most part. No automatic infusers. Everything's pretty much done by hand, right? So they have huge issues there with caring for people, and they're doing the best they can. This is one of Pete's photos. Again, just people on a road. This is leading out of Freetown to Cologne, where the treatment center was. People waiting for rides, hoping to get past the checkpoint. A treatment center here. Again, this is how strict they were with keeping their distance here. So people are here in the treatment area, and this person is actually reading notes, and it's being screamed across this area, this safe distance, to this person who's taking down in the doctor's notes, right? So nothing comes out of this treatment center, absolutely nothing. So when they're telling you how his patient's doing, he's writing it down over here. It's just passed across this here. This is with a disinfecting team. So when they find bodies or they suspected cases at different places, these teams go in with disinfecting solution, which is basically, again, just chlorine and water to disinfect these areas. Right, so I don't want to make this such a boring and somber, like, the end is near talk. I mean, there was everyday life went on as one. So I just want to show you, like, what I wore every day, right? I mean, fairly normal, right? I was hot, actually, because I really didn't want to get bit by a mosquito and get malaria. So I wore long sleeves and long pants, and I used DEET a lot. So that's me, and I had what was called a fixer over there, and Sullivan. That's Sullivan. So he was from Kenema, Sierra Leone, a local guy who helped me navigate how to get around Sierra Leone. You can't rent a car in Sierra Leone. There's no Avis, Hertz over there. Someone has to have a car and allow you to go with them. And so Sullivan was able to arrange that all for me. He led me around different places. He spoke the local language. A lot of people do speak English over there, but they also speak a dialect called Creole and different tribal languages, and he was fluent in 2 or 3 different ones. So we are actually here at a facility where they were setting up, and just to give you an idea of how many different challenges this country is facing, they were setting up a new Ebola isolation ward in one place, and it was on the campus shared by a TB hospital and a leprosy ward, right? And both places, the TB hospital was full, the leprosy ward was full, and now they're going to end up adding an Ebola ward on the same property right there. It was kind of a hairy situation. I was like, there's a lot going on in this one little place. But they're really, I mean, people are working very hard to try and change the way things are going over there. Again, we were not all dour and terrified the entire time. We actually tried to have a little fun. Again, that's Sullivan, that's me, at one place we went out to eat. So I want to talk now about a little bit about some of the folks I met over there, the different people who were doing yeoman's work over there. So this guy here this is Dan Kelly. He's an infectious disease doc from UCSF. And he had come over to Sierra Leone at about the same time I did. And he had run a nonprofit hospital in the country for several years and was moved to come back by the Ebola crisis. And we are here at a children's hospital that had been shut down. What we might call a pediatric referral hospital, the main pediatric institution in all of the entire country of Sierra Leone. It was in Freetown, called Ola During. It had been shut down for a couple weeks already because of one Ebola patient had been in there. Again, to figure out how difficult this is for this country to deal with, a 4-year-old child came into the children's hospital, fever and vomiting, and they thought, oh, malaria, dysentery, anything, right? It could be any of those diseases, and it turned out to be Ebola. And as a result, the doctor stopped coming to work, the nurses stopped coming to work, every patient who could get out left, right? The other patients were sent to other institutions, and it just shut the entire place down. So a lot of this, the fear that I think the US is dealing with, you can see playing out in Sierra Leone on a much grander scale. But it's not unique to them, right? Because we've shown we can be pretty scared too. And so Dan's mission, it was incredible, was just to restore that faith. And the way to do that was to teach them how to use the PPE. So he held clinics over 2 different days trying to train every single doctor and nurse from that hospital how to put on and safely take off the PPEs. So at the beginning of the epidemic, the problem was they didn't have the gear, right? They didn't even, they wore gloves sometimes. They wore the masks sometimes. Now, by the time, later in the summer, they had the gear. They had been donated to them. It was coming in all the time, PPEs and gloves and masks. They had plenty of that, but they didn't have the confidence to use it. And so Dan went through this incredible, just intensive, it sounds so basic, just training these people how to use it. And 3 weeks later, took a little while, they were able to reopen the children's hospital, right? Because they had the faith, they had restored the confidence in the people. Right, these are just some local Sierra Leonean guys. What they were doing actually is illegal at the moment, right? So they were actually gathered in a group of there was maybe 10 of them on the beach there, and that was illegal. So it was an example of the social distancing. Don't want anyone gathering together. But the government was not enforcing it that strictly because, well, people got to be people. It's just talking to them and just about getting it. So the idea that everyday life goes on in some respects. Everyone wasn't sitting at home with the doors closed and just sort of panicking, waiting for this to pass. You sort of had to live your life. This is an expat couple. The girl here, Naj, she's from Portland, and he is an Irishman. Neither one of them at all involved in the Ebola response, but just happened to be there. And it was interesting about how a lot of expats, people, the country had been stung by the wealthier citizens leaving, right? So everyone who could leave Sierra Leone was gone for the most part, right? Because if you could hop on a plane and afford to live the rest of the year in Lebanon, where there's a big Lebanese community in Sierra Leone, or go to England or go to Senegal, go anywhere, you left. And that was devastating economically for the country. But there was this group of expats who really wanted to stay and stick it out. And he was an architect. She had worked for an NGO, and they decided to stick it out. And I wrote a story about them, just about people who actually who didn't need to stay, but were staying, and trying to find their new role in the country. So this was the main line of defense. And this has become such a big hot thing here now, right, that we're going to start screening everybody coming home from Sierra Leone or Liberia or Guinea. We're going to screen them for temperature and make them monitor themselves for 21 days. So they were already doing that at the airports in Sierra Leone and Guinea and Liberia, and very much did not want to fail this test at the airport. So one of my big concerns there, like I said, was getting sick, and it was not necessarily even getting sick with Ebola, but it was getting sick with malaria or just getting a cold and popping a fever, because I did not want to get stuck in Sierra Leone, right? I did not want to have a car accident in Sierra Leone because I didn't want to go to the hospital. No one wanted to go to the hospital. The hospitals were empty, right? Because no one, that's where the Ebola was. I'm not going to go to the hospital. No one wanted to go to the hospital. So there were a lot of concern about, I was in Sierra Leone for 10 days, and that was sort of intentional to limit the time that I was there, thinking that if I got infected on day 1, I probably would not be symptomatic by day 10, I could get out, right? And I wanted to get sick in the US if I was going to get sick, right? Not get anyone else sick, but I wanted class A, treatment. Everyone's worst fear. And that's why when they talk about closing the borders and, that's going to really affect the response. The doctors, I don't know why anyone would go over there not knowing if they could get back here. And that's why it's also really important that the US Army is building that hospital, and it's taken a lot of grief for this, that's only going to take care of foreign healthcare workers over there, and then also maybe ship them back here. But if you're going to go there, you need to know that you're going to be taken care of. If you're going to risk your life to treat other people, you need to be taken care of, to relay at least that one concern. Maybe Ebola is bad enough, but then this on top of it. So it was nerve-wracking getting out of Sierra Leone at the airport there, Lungai Airport, which is amazing too because it's actually separated from the country by a river, and so you have to take a motorboat from the airport to the mainland in order to reach the rest of the country. But on the way out, just worried about, am I going to pass this test? Am I for some reason going to pop a fever? And who knows what's going to happen? And so it was really nerve-wracking. And so I had a bunch of ibuprofen with me, just in case, right? Yeah. Again, no one wants to get anyone else sick, but I also was not going to get stuck there as well. And that was the talk of everyone in line too, just the other doctors and nurses like, please don't let me fail this one, So it was interesting to see. And this was actually my ticket out of Sierra Leone, and it's not the ticket itself, it is what it says there in the POS number, what I scored as a temperature, right? That's how I got out. And when I got that, I was like, because it's stressful. It really is. It was a stressful time. I mean, so when I was over there, I didn't touch anybody. I tried not to touch anything. The different doctors I met and things, great people, but it was tough. It's exhausting to constantly be on alert, worrying about, did I do everything right? Did I touch my eye before washing my hands? Did I make any mistake throughout the day? And I wasn't even treating people, I was out and about and probably putting myself in some sketchy situations, but I wasn't taking undue risks. I was, no one bled on me, That group of guys down by the beach, one of them got a little too close to me, right? And he was like one of these people I thought could have sworn I saw some spittle come out of his mouth, And you start having crazy thoughts, and it's full of anxiety. And I know that a lot of the first responder groups and medical groups have intentionally limited time in country for people because it is stressful, right? 3-4 weeks, all right, get out, go take a vacation, then come back, right? Because it's just too much, it just wears on you. And so it is a different disease, it is a different experience. These are slightly out of order. So, again, this is, right, not Sierra Leone. This is Dallas. And so it was really fascinating, especially, I've been over in Sierra Leone and suddenly it comes here, and the way we reacted was just mind-boggling, right? And not that we overreacted, but we reacted kind of like West Africa. There's a bit of a panic there. So over the summer, a lot of people were writing these stories and sort of almost like, oh, look at those West Africans, look how they have all these silly beliefs about Ebola, and they're dealing with it in such a bizarre way. And there's a slide I don't think's in here anymore, but there's a guy who has a T-shirt that says Ebola is real. There was a huge campaign just to make people believe that Ebola is real, right? Over here, we had no problem with believing Ebola was real. But we had problems like sort of figuring out what the facts were, right? Ebola is everywhere, right? That school teacher from Maine who happened to be in Dallas like 10 miles from the hospital who placed herself on 21-day quarantine for some reason, right? Because she somehow passed through there. And so we, with scenes that really, except for they're a little bit more high tech, really could happen out of West Africa. And it actually is sort of interesting. Sometimes you can play, when you're looking through the wire photos, you're sort of like playing, is that, Dallas, West Africa, Dallas or West Africa, different. different scenes. Right, so we've had some weird things happen here, right? The clipboard guy, right? Everyone hear about the clipboard guy? This is one of the nurses, I can't even keep track. Maybe this is Nancy Phalm, who went to NIH, which she's put on an airplane. And there was like, everyone made a big deal about, what's up with this one guy? Why isn't he wearing, PPE? And he is there intentionally to help everyone else who is in PPE not run into the side of the airplane, right? He's intentional. But again, it's a very contagious disease through contact. He's not touching anything. He keeps his distance. And the nurse is right there in PPE, so there's absolutely no chance for him to get infected. But again, we had the nurse who went on the cruise, right? The Ebola cruise, right? That Belize and Mexico denied port of entry, I did find a little surprising all these nurses went on vacation as soon as they got done taking care of the one who went to Akron, who went to Ohio at least, and then she popped a fever and these different things. But it sounds like they're getting good treatment now at NIH and Emory. So we've had these different things that, I think certainly a year ago, no one ever thought this would ever happen in America, and I think we've realized, again, how close everything is, and how intimate we really are with everyone. Again, so there's a photo at Dallas. I just wanted to point one thing out of here. And again, this sort of speaks to the education about what Ebola is and what it's not. The guy's wearing a respirator, right? Well, then why is that guy wearing a respirator? If it's not airborne, why is he wearing a respirator? I don't know why he's wearing a respirator. If it makes him feel better, that's great. Let him wear a respirator. I think he's actually going to go over there. I think that thing is like some sort of, should just be bleach solution, right? And he's going to wash off something off the sidewalk, And it's good to be suited up, And there are limits to what you need to do. He does not need that fine particulate respirator there. But it does, in terms of educating the public and sort of making people realize that Ebola is scary enough without us worrying about these crazy things, But then they see pictures like this and they notice, well, there's something they're not telling us. No, we're telling you everything, but some people are just doing things a little bit, beyond what's needed, and that's fine. Right. So, there is this irrational fear, right? I can tell you when I got back, it was kind of funny. Getting out was incredibly difficult because they were canceling flights left and right, and I really was a little bit worried I was going to get stuck in Sierra Leone. I was like, what am I going to do? I was going to have to jump on a UN plane or something. And so I flew from Sierra Leone to Liberia to Dakar to Casablanca, and Casablanca, the US. And each stop along the way, they took my temperature in Africa. Now, when I got to the US, I walked right through customs, and the only question the guy asked me was, do you have any beef jerky? He saw that I'd come through West Africa. That was the one question he had. I don't know if that was illegal or, So I'm actually glad to see that we are doing surveillance, that we are taking people's temperatures and making them aware, if they weren't already aware, that, they need to pay attention to this. But I still ran into a fair number of people who were concerned about me being in West Africa and being in Sierra Leone and covering Ebola. I stayed out of the newsroom for, I believe it was 14 days. And again, I went before we had real policies, right? We're sort of making this up on the fly. 14 days, why 14 days? Well, it seemed like most cases popped in the 10 to 12 day range. There's a 21-day incubation, but for the most part, 10 to 12, it seemed to be like if you were gonna get sick, that was most likely gonna be the range. So I went back to work on the 14th day. Now I went back and I took precautions, right? I was constantly washing my hands. My coworkers didn't get too close to me. I was taking my temperature like every couple hours. I had a high reading of 99.1 at one point, which kind of freaked me out because it had always been like below 98.7 before that. And I retook it like, maybe an hour later, it was back to low, right? And it sort of plays with your mind, sort of like, I slept in the basement at home for 3 weeks too. I sort of didn't want to get my family infected, Bad enough I catch Ebola, but God forbid I give it to everyone else. So a lot of this is personal responsibility. I think a lot of fear too is that, we sort of have to trust and believe and hope that people are responsible. And we know people aren't, and so it's kind of scary. We have to believe that people are going to be watching themselves and taking care of them. But even recently, I know not to mention to people that I went to West Africa to cover Ebola. On my way here, I think I've told the story. I was picking up the rental car, and the rental car guy, wants to make a little chit chat, and he says, so what are you doing? I'll say, I'm going to the University of Georgia. Oh, what are you doing? Oh, I'm giving you a talk. What are you talking about? Journalism, because he wants to shake my hand, be very awkward. My wife went to the dentist just a couple days before I came down here and happened to mention what I'd been doing and mentioned Ebola, and the dentist freaked out. Don't you know that it's not 21 days? Actually, they're talking about this, 31, 41. We don't know what the incubation period is. My wife just rolls her eyes. What can you do? There's a lot of fear out there, and trust me, I've looked at the different studies and talked to lots and lots of experts to figure out if there is a hole there. Because for my own, I have a little stake in this, right? Feel really confident that what they're telling us is what they know, right? And so far, I've not seen anything. If it was airborne, we'd be seeing hundreds of thousands, if not millions of cases, right? It seems this does not look airborne in any way, shape, or form. No one's seeing signs at 21-day outside the 21-day window, and like I said, for the most part, the 10 to 12-day window. I thought the most encouraging thing about the whole Texas debacle, and it was a debacle the way they handled that, was that Duncan, the man from Liberia who got sick and unfortunately died, right? Remember, he went to the hospital with that high fever, and they sent him home, which is unbelievable. Because I had a plan, right? So if I had gotten a fever and gone to the hospital, I was going to tell them that I basically had Ebola, and I was not going to leave until they had tested me. I was terrified, but I have Ebola. You have to test me. But the Liberian man, he did the right thing. He did the responsible thing. He did the thing we want them to do, and he probably thought, well, these American doctors must know more than I. I'll go home. Of course, they were wrong. But he went home. He was home for another 2 days, right? In that house with his family and the young kids. And then he goes to the hospital and he gets diagnosed and he's away. And so what happened to the family, right? They didn't get Ebola. They're outside their 21-day window. And to me, that sort of speaks volumes about, now his family sort of suspected he had Ebola, so they were taking some precautions in the house, but still they were sharing a house with the guy, and they didn't catch it from him, right? They were careful. And so it's possible to defeat this. It's not some monster disease. I mean, it's scary, but it's not some unknowable monster. Right, so here's another photo. Again, some of these are out of order. This is the US. You can tell by the modern ambulance. Right. Again, this is another MSF photo. How them suiting up, taking off the PPEs. So like I said, I'm not a huge risk taker, right, by nature. And I'm still a little surprised that I decided to go over there. A lot of people passed on this because it is so scary. And only now in hindsight can I say it was worth it. But it's such an important story. And it's one that we're going to be living with, I think, for a while longer. There's some encouraging news on the different fronts, right? I think the infection rates might be slowing down, right, for now. But again, right, they had slowed down. The reason we got in this whole situation is that the outbreak pops out in March, flares up briefly, and then disappears, right? And everyone sort of goes, oh, we can go home. Even MSF, who's always sounding the alarm, right, said, oh, maybe we can go home. And then in late June, it exploded out of nowhere, right? And this has burned relentlessly since then. But now we're starting to see the rates actually somewhat slow down. Now the numbers are really iffy, right? Because the surveillance health systems over there are kind of bad. The lab reported numbers are not even counting it anymore because they barely have the capacity to test patients who need treatment, much less patients who have passed away for any reason. So our data is actually not very good. But there are signs to be hopeful that this will pass and not burn too much more horribly, and certainly, hopefully, will not spread to other countries in any sort of intense, entrenched way. But yeah, it's a really important story. I'm really glad I did go. And a lot of brave people I saw over there doing just yeoman's work. So I really just wanted to share that with you all and answer questions. Great question. Yeah. So how was I perceived, and foreigners in general? It's interesting because they have a really great history of, really deep history of NGOs being involved there, and I'll be quite frank. They have a great history of white people being there, connected with some WHO, UN, and responding and helping. And that was both and talking, this is not me sort of speaking this, but talking to different public health officials, it was both a burden and a gift, because they were worried that maybe the governments and the people there were waiting for the NGOs to come in and the UNs to come in and rescue them rather than do it themselves. But they were incredibly gracious and grateful, and they understood exactly why we were there. Now, there was a lot of fear and misunderstanding about what, like, there's rumors about white man spreading Ebola, and this is all some sort of thing. Actually, the biggest reaction I got was about ZMapp, right? The wonder drug that we don't really know if it works, but given to several doctors right away. And in Sierra Leone, it caused a big stink because a hero in their country, this Sheikh Khan, Dr. Sheikh Khan was a top virologist. He caught Ebola and died. And there was a period when he was sick where they were debating whether to give him ZMapp, and they decided against giving it to him. God knows why, but they decided against giving it to him. And it became a real sticking point. And so they were always asking me about ZMapp. When are they going to make more ZMapp? When's that ZMapp going to get here? And so it was almost a distraction, though, right? Like the outbreak's not going to end because of ZMapp. But they were really just sort of feeling that maybe they weren't getting everything, that we knew something they didn't when we really didn't, I don't think. But they were very kind and gracious. I mean, just wonderful, actually. Yeah. I think a little bit of both political and cultural. I think originally they were responding to this outbreak, basing it on every other previous outbreak, right? And it seemed, and they still don't know really where Ebola comes from, where it makes that leap, what makes it introduced, but they suspect it's either the bats or the fruit droppings or some combination. And so they instituted the old rules, and the old rules called for no bushmeat. And there was just a lot of pushback on that. And as they did more study and they saw that this was not having multiple entry points into the population, they realized they could stop talking about that, and it wouldn't make any difference. And it made people happy, right? So, there were such other bigger concerns, like they said, we'll stop talking about that. But there are a lot of balancing acts, about stopping it, but not also making people not wanting to play along, right? You need their cooperation. So yeah, there was a little bit of both. Yeah, so what is a good balancing act between those different measures? I think we just keep on recalibrating it, right? And I think we overstepped it in some points.
Specific situations?
Sure. Well, I mean, the elephant in the room, maybe. I understand why the university was hesitant to have the Liberian journalists here straight off a plane from Liberia. I understand that. The official policy of the Washington Post now is that no one goes in the newsroom 21 days after making this trip. All right? A lot of universities, when their medical staff go over, they are not allowed to go back to treating patients for 21 days. So it's not really that unusual, this 21-day window. That's pretty hard. I had plenty of interviews cancel on me in my 21-day window. So yeah, I think we're still trying to figure that out. But the irrational fears, like keeping kids out of school and stuff like that, and that seems to be over the top. But I think we are still sort of figuring out. So Syracuse University got into trouble for disinviting a Washington Post photographer to come speak at their university. The crucial difference being that he was outside his 21-day window, right? And they sort of relied on this sort of fallacy. I'll call it a fallacy. It's not true that they have to really worry about a 31 or 41-day window. It's just not true. We can argue about it, but it's just not true. But she was bowing to concerns, and people are, and so you have to balance those things. You don't want to make people angry, but I think we're sort of working our way through it as well. I mean, and I think these different events will affect it, right? So if the passengers on the Frontier plane that were on with that nurse, all right, I'm just going to say it, none of them are going to get sick, right? Now, if one of them does get sick, we can all freak out. We really can, because there's something going on, right? That shouldn't happen if we're playing by the rules that we know, right? Now, I'm glad the CDC's tracking all them and in keeping contact with them. Unless there's something happened that we don't know about, right? There's no way they get sick. And it was terrific that none of Duncan's family members got sick. And as badly as Dallas screwed up, it's actually pretty good news that actually only 2 nurses got sick, But we don't talk about the successes, right? We don't talk about Nebraska, right? Which has done well with 2 patients, maybe 3. Emory, right? NIH, they've done well. So hopefully, we can sort of restrike that balance. Yeah, so when you say the media, we're going to chop that up into different groups. Yeah, I mean, Ebola is like, that's Hollywood, right? Ebola, everyone, well, Outbreak, the movie Outbreak, Contagion, right? So there's an element of that, and so it lends itself to being ramped up and getting hyped up. And the responsible thing, though, is, right, to not do that. And I don't know how you ever keep people from ramping it up, and to keep it out, And it's gotten difficult too because, right, we don't have any more media gatekeepers. We're not going to turn this into a media ethics class or media theory class, but we don't have gatekeepers anymore. And so, there's nothing to stop someone from on Twitter or wherever, espousing crazy ideas. So, but it is incumbent upon us to report responsibly. And, it's difficult too, though, because it is, we're humans too, and we're trying to fight back and choke down that fear that we have sometimes and try to report soberly and responsibly based on what we know. So it's a challenge, though. And I agree, there's been times I've seen other reports, I'm like, oh my God, how did they write that, Again, like this 21-day window thing has gotten blown open because of an open source, non-peer-reviewed journal article written by an engineer. What are you going to do? And that also hasn't helped that some people who actually have credentials have also sort of given this life as well. I'm not going to name them, but so that hasn't helped. So yeah, not all media though. Response? Yeah. So what sort of like conflicts and collaboration between all different groups there? Yeah, it was like a clown car of different groups, right, on the ground there. So MSF was first, right? They were on the scene first. They had this treatment center. They were leading the charge, and they are just an incredible group of individuals. And then, so in Sierra Leone, it was different for each country. But in Sierra Leone, after MSF came the CDC, and then at the same time, sort of the WHO. And so they actually, the way they operate in country, though, is that they are there at the leisure and at the pleasure of the local government, the federal government there. So they actually had to coordinate everything through an EOC, an Emergency Operations Center, run by the national government, the Ministry of Health there. And through there, that's how they did the coordination. So it's sort of interesting because, you think about, there's things maybe the CDC would like to do in Sierra Leone or Liberia or wherever, but they can't do. They can't just sort of impose US law or their will or whatever on the ground. They have to convince the federal governments that these are things that need to be done. And so it was, at times there was a lot of sharp elbows and sort of upset about, we need more of this. And, a lot of people were upset at the WHO for being late to respond to this. MSF was calling them out, no problem. And I agree, I think, the WHO's admitted that they were a little slow to pick up on this. Well, they certainly were slow to pick up on this. And trying to divvy up the different responsibilities, who's going to do contact tracing, who's going to do surveillance, who's going to make sure the supplies get in there, logistics, CDC is going to take care of the lab work, right? Who's going to take care of this? And so that's all done through the Emergency Operations Center, but again, though it's headed, though, by a Sierra Leonean official, which is very important for these outside groups to actually have buy-in from the local governments, because once they leave, they need to have these groups, running the show themselves, and they want to, they just don't have the infrastructure to do it. So yeah, in past outbreaks, burning down the houses, decontamination. I did not see that. I heard reports of that, and I know it was going on. Now I think they have there's people with the sprayers who go in and do that, but I do know there are villages who insisted on burning down all belongings, everything. Actually, I remember Ken Brantley, right, the first U.S. doctor who got Ebola. He came to the Post to talk to us a couple weeks ago, and it was actually kind of funny. When I was shaking his hand, I had to make sure that he was okay shaking my hand, right? I'm actually more closer to Ebola than you, so, but he was cool. But he talked about how everything he had in Liberia was burned, just incinerated, probably an autoclave, right? But I mean, it was somehow destroyed. But yeah, they still do, that's a very effective method, right? Out in the bush, just, you don't have necessarily access to disinfectants, certainly not an autoclave or anything like that, so torch it. And they were I know they're still doing that in certain districts in Sierra Leone. So how are locals responding, especially with the cultural practices? Yeah, the death rituals, right, of the cleansing and washing of the body is just, it's been a huge challenge, right, because it's really ingrained. And You hear reports of people forging death certificates, right? So anyone who dies of a Ebola confirmed or probable case, you can't have a traditional burial, right? They're going to take that body from you. So people now get forged death certificates so that they can have a clean death, right? And they're still working to overcome that. I know there's actually been some really interesting work, and I don't think it's been deployed to the field by like cultural anthropologists about ways to introduce new practices, right? I don't know how you change hundreds of years of practice, but also explain to people like, you don't want to get sick, and sort of really, they don't understand the microbial idea of disease, right? That you touch and something you can't see gets into you. This is how it explained to me. And so really sort of changing that mindset has been a huge problem, and just getting people to acknowledge. And as I said, just getting people to believe Ebola is real, that this is something, you don't understand it, but just listen to us, trust us, you shouldn't be touching this dead body. And again, also caring for people in their house, this is very difficult. Sierra Leone recently admitted, to some extent, failure with the outbreak response, and they had started moving to home care for Ebola victims, and they were distributing home care kits, basically at-home PPEs for people, and sort of giving them you actually saw people constructing their own PPEs, right? Plastic bags over their hands and garbage bags over their head, which was sort of ingenious, right? Just do it yourself. You don't need something made by 3M. You actually can do it yourself, and in a pinch, it actually worked. But they were now realizing that not everyone's going to come into treatment. Some people are scared, and so let's at least try and figure out a way. Let's adjust to what's going on the ground and treat it that way rather than saying, this is how the textbook says to do it. We demand you come to the treatment center. All right, if you insist, this is how we're going to do it. But I know they're still trying to work out what the burial practices, because that is a huge problem. Yeah, the Sierra Leone press was fascinating. Yeah, they were all over the place. Again, it's doing a great job of trying to stay on top of this. They were very much more interested in the interplay between the government and the medical response, right? And so they were really going after the government for failing and not doing things. So when something went wrong, it was the failure of the federal government, the leader in charge. And I think there were elections scheduled for this winter, December, and I'm sure they put them off. But they were very concerned about the political interplay. And I actually, sometimes though, I still heard little talks about, within the press, again, they have a free-ranging press, just all over the place, spreading these conspiracy theories. There's actually one paper fairly famous in Liberia, I can't remember the name of it, for spreading conspiracy theories. Actually, there was a US professor who wrote crazy conspiracy theories published in the Liberian press and then takes on a life of its own. But they actually were very responsible, but again, they were more focused, I thought it was sort of interesting, in that political interplay. But who's responsible? Who's going to pay for this? Right, so yeah, they're dealing with the Ebola orphans. And that's gotten a lot of attention, and a lot of hate groups have been focusing on that. Because you have these parents, you lose both your parents, and then you're sort of untouchable. And they've really worked, they've tried to, so people are scared of the Ebola survivors, which is sort of unfair, actually. They're sort of supernatural. They should be hailed. It's amazing. And so when you get out of a treatment center, if you survive, right, there's only, as they say, there's only two ways in or out, right? If you survive, you get a certificate signed by the government. And there's a ceremony, very brief, of people cheering and applauding you. And they very much want to keep you in the system. And so they try and give you jobs around the treatment center, just do something to reintroduce you, to give you some, before going back to your village where you might be shunned. And they have a huge problem with orphans, child soldier orphans, from the Civil War, but now, these orphans here. And so I know that there's different NGOs and aid groups who are working very hard in sort of caring for them separately and sort of trying to figure out routines for reintroducing them, people who, so they won't be stigmatized, right? Because there probably is, it's a pretty heavy stigma, unfortunately, because like I said, they're sort of the superstars of this whole thing. Do I plan to go back? I do not plan to go back. If assigned, if ordered, I will go. But they wouldn't order me. But if I go back, I feel like I got lucky, and I don't want to press my luck. But again, sort of the allure of a great story might pull me back. If I were to go back, maybe go back a little while to Sierra Leone. I'd also love to go. I feel like Guinea hasn't gotten enough attention out of this whole thing. They've had some incredible successes against Ebola. And maybe it's because it's a French-speaking nation, and we're not very good with languages, and that's why we haven't heard as much about them. I know this would never get approved. I would love to go to the Congo, because the outbreak there that, on every other year we might be paying a little bit of attention to, but it's playing out the way Ebola outbreak should play out, which is sort of isolated, bad, but so yeah, I'm not aching to go. So it's definitely a zoonotic disease in terms of how it originally came across, but like whether animals could get it and then give it back to us. You're talking about like dogs? Yeah, I mean, I think they would, if they could figure out reliably exactly which animal was giving it to us, I think they would definitely, but the problem is it's amazing, they still aren't exactly sure. They think it might be bats, it might be maybe a tick that lives on the back of the bat, it might be something, they're actually still trying to work that out. But, the issue actually about dogs was sort of interesting because that was a big deal here with the pets of the nurses, and they put down the dog of the Spanish nurse, right? And that caused a huge outrage. They have so far not put down, and I saw today, like they had an Ebola test on the dog, and the dog here in Dallas is okay, or in Dallas. And it's not believed that animals can actually transmit it to us, but actually in Sierra Leone there was a huge concern with, and this is kind of horrible, wild dogs feasting on the bodies left out of Ebola victims and then somehow transmitting it to humans. That's a sort of a different scenario. Maybe if they still had it on their fur, and they had been in the blood, and so people were, this is a panoply of different concerns over there versus what we have to worry about here. The dog issue is very strange. But yeah, I don't think if they could figure out, where this exactly came from, they definitely would love to, prevention, right? And that'd be awesome, yeah. What was my family's reaction? So my wife, I was counting on her to say no. She was going to be my out, because I was kind of like, what am I doing? And she didn't say no. She was encouraging. So she's a photojournalist. So she understands like the allure of a great story, and she didn't, wanted me to take precautions. My mom, it was kind of funny, she was actually not all that wanting to stop me either. But what was actually kind of funny is when I got back, I sort of realized she didn't really understand what I was doing. And when she, Ebola had been played up a little bit more, and so actually I had dinner with her like a couple nights after I got back, and she was kind of like, we're not sharing the soup, right? I was like, don't worry, I'm not sharing the soup. So they were supportive, and it was good because, like I said, I was, I would have been okay with her saying no and me not being able to go, but I'm really glad that it worked out,
So,
Oh.
so let's thank Todd Frankel for being here. Join us.